Good morning. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please keep your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient for the study purpose, and you can have a continuous study because of this. Thank you very much. I hope you will make use of it. My dear friends, as you know, we are discussing about newborn care. In the newborn care, the first part we have covered, which includes some of the basic introduction. Newborn care includes two types as for Ayurveda. Number one is routine care of the child, and number two is emergency care of the child. Rightly, Ayurveda explains the different steps of the routine care of the child, and also Ayurveda explains the different steps of emergency care of the child. When I say emergency care of the child, it refers to prana pratyagamana. When I say routine care of the child, it refers to Navajata Shishu Paricharya. So let us see why prana pratyagamana and resuscitation are one and same. In the last class also we have seen the word meaning of prana pratyagamana is prana prati agamana, whereas word meaning of a resuscitation is apparently lifting the baby from a death-like condition. So meaning of both the terms are almost all same. Now, what Ayurveda says is when prana pratyagamana or resuscitation is required. According to Charaka, it is very clear that any baby which is acheshta at the time of the birth. Okay, acheshta means there is no spontaneous movements at all. Baby is not breathing, there is no respiration, there is no pulse, there is no muscular movement, there is no facial movement, there is no grimace, nothing is there. Baby is totally acheshta. It is not nicheshta, acheshta. So, any condition where child is acheshta, yavat tat acheshta syat. Okay, he says that. So, yad acheshta syad yavat prananam pratyagamanam. Prana pratyagamana should be done for such babies who is or who was acheshta at the time of the birth. That is a nil baby, sick baby, or a limp baby, what we can say in terms of other medical science. Now, what Ayurveda says is every birth is emergency. So this is told by Kashyapa very clearly. So what he says is at the time of the delivery, one leg of the mother will be there in the Bhuloka, and at the time of the delivery, another leg of the mother will be there in the Mrityuloka, Yamaloka. See, this simile he has given, but so beautifully it explains that every delivery is an emergency. Emergency can occur at any point in time, especially may be related to the mother or may be related to the baby. So as we are talking about pediatrics, we are taking more towards the pediatrics. So anything can happen during the delivery. Okay, baby may be born normally, baby may be born abnormally, or may be sick, or may be healthy. So therefore, a pediatrician or neonatologist should be prepared completely to face any delivery, to face any emergency, irrespective of the condition. You know that everything is fine, definitely it will going to be a normal delivery, but still, you should be completely equipped with all the instrument which is required to face any type of emergency. Therefore, Kashyapa says that one leg of the mother will be there in the Bhuloka, another leg will be there in the Yamaloka. Anything can happen at any time, so be prepared. So every birth is a emergency. Now, prana pratyagamana may be required in case of post-term babies. Whenever the problem will be more with the post-term babies compared to the preterm babies. Preterm babies, although they are delivering earlier, before the completion of their gestational period, but the complications are quite less when compared to the post-term babies. Post-term babies are more complicated. The reason is, in the post-term babies, what happens? Number one is the maturation is more. Okay, so they will have more stronger muscular movements compared to the preterm baby. So there will be a gasping and chance of meconium aspiration is more. Point number one. Point number two is, as the postterm takes place, that means in the sense, a placenta start degeneration. Now, placenta will be there only for the fixed time, 9 months, 9 days. Okay, and after that, if the pregnancy is persisting, the placenta is not responsible for that. Placenta after completion of 9 months and 9 days, it start degeneration. Before that, even slowly it start degeneration. Now, if the postterm baby is staying for a longer time in the uterus, meantime placenta start degeneration, and demand of the postpartum baby is also more. Placenta is not able to fulfill that demand, and definitely baby will have asphyxia. Therefore, always postpartum babies will have more complications at the time of the birth compared to the preterm babies or normal babies. So this is one indication for prana pratyagamana. Next one is preterm babies with the IUGR babies. Preterm babies and IUGR babies. Even the preterm babies also will face so many problems at the time of the birth. The reason is preterm babies, their surfactant is not completely developed. Surfactant is present in the lung alveoli, which is required for the compliance, increase of compliance, expansibility and compliance of the lung. So if the surfactant is not completely mature, definitely baby will have some problem with the breathing at the time of the birth. We have to go for assisted breathing. So even in the preterm babies also we require resuscitation. IUGR babies, yes, compared to these postterm babies and preterm babies, IUGR babies are little safe. Okay, we do not face much complication related to IUGR babies, but sometimes there may be meconium aspiration like problems will be there. IUGR babies are just like those, so they are habituated to face the emergency. Okay, from the beginning itself, IUGR baby is not getting the proper amount of the nutrition, or from the beginning itself, the IUGR baby is exposed to some of the infections and all those things, because of which his height and weight is not increasing, and he has got that tolerance power, and immediately after birth he will not have much problem. He may have definitely some of the problems, but will not have much problems. Problems related to uterine contraction, abnormal presentation. Now, if suppose prana pratyagamana or resuscitation is required, if there is some problem related to uterine contraction is more prolonged, or proper contraction is not there, descent is not there, so like these problems may lead to the requirement of a prana pratyagamana at the time of the birth. Abnormal presentation like shoulder presentation, breath presentation, definitely baby will be asphyxiated, or baby will be under stress, maybe baby also injured sometime, and this all requires resuscitation immediately after birth. Now, if the mother is suffering from some of the antenatal problems, yes, you should be ready for prana pratyagamana. Antenatal problems includes mother suffering from hypertension, mother suffering from diabetes mellitus, mother taking maternal drugs, mother is having pelvic contractures. Okay, so then mother is having anemia. So these are some of the conditions where mother is suffering from, mother had the meconium aspiration, meconium passage, earlier meconium passage, and there is a leaking of amniotic fluid, premature leaking of the rupture of the membrane. So all these problems require resuscitation at the time of the birth. Okay, or there may be requirement of the resuscitation at the time of the birth. High risk pregnancy, all the problems with the high risk pregnancy, mother is having antenatal hemorrhages, mother is having antenatal problems, mother is having antenatal infections, intrauterine infections. So we should anticipate the possibility of requirement of a prana pratyagamana or resuscitation procedure at the time of the birth. Twin pregnancy may also require the same. Next, Mudagarbha like condition, that is, this is a presentation related. That means if the shoulder presentation, buttock presentation, breech presentation, and different types of presentations are there, where the head is not delivered first, rather other body parts are delivered first. So that always requires the resuscitation. Atulya Gotra Vivaha. Suppose if there is a history of Atulya Gotra Vivaha, then we can anticipate some of the genetic problems. Recessive type traits of genetic problems may be anticipated, and in some of the genetic problems there is requirement of the resuscitation or prana pratyagamana. Maternal disorders like bronchial asthma, maybe epilepsies or hypertension, diabetes, mother is taking some of the drugs, and baby will, the fetus will have the complications of that because of transplacental passage of that particular medicine, and that may lead to so many congenital abnormalities and some other problems, and this may require prana pratyagamana at the time of the birth. Now, drugs and procedure during the pregnancy and congenital problems of the mother, and not following the Rajaswala, Rutucharya and Garbhini Paricharya, etc. Congenital problems of the baby, like suppose microcephaly is there. So baby is having microcephaly, definitely there will be a problem with the descent of the head. Okay, and there will be prolonged delivery, and you may require, baby may require prana pratyagamana. Okay, and lastly, the most common is meconium aspiration. Okay, because of the various problems, mother will have problems with the uterine contraction and all. Then the baby will have fetal distress, and fetal distress leads to hypoxia. and because of hypoxia, so there will be exaggerated body movements, and that leads to sympathetic stimulation. Sympathetic stimulation leads to passing of the meconium in the amniotic fluid, and that fluid will be ingested by the baby or engulfed by the baby during this process of this convulsion, contraction and all, and that baby may aspirate the thick or thin meconium. If it is thin, it is okay, but if it is thick, it is more dangerous. So these are different situations where prana pratyagamana is required or resuscitation is required. Now, when to do resuscitation as for Ayurveda? Charaka mentioned different procedures for the acheshta shishu. This is what I have described. Ayurveda explains any babies with acheshta, not showing the proper movement or response at the time of the birth, or the baby is not showing any movement, pulse, respiration is absent or diminished, then you have to go for resuscitation. So this should be done immediately after birth. So the word meaning acheshta, the word is there, acheshta. So what you have to take by acheshta? Baby is not showing any movement, that is called as acheshta. But in contemporary science, so we shall have three important. One is primary apnea, secondary apnea, and terminal apneas. Primary apnea, we know that initially baby is not crying, but as soon as the cord has been cut and negative pressure is created, back pressure is created, then touch sensation and all those things, the respiratory center is stimulated, baby start crying, so then it's okay. So that particular phase where the baby is not crying immediately after birth for a few seconds, so that period usually we will call it as primary apnea. Once the baby started crying, and after crying after 1 or 2 minutes, baby gradually decreases the activity. That means the baby's activity is decreased. Then there onwards the cry is diminished, color is now more and more bluish, baby is going down, sinking down. So that condition usually we will call it as secondary apnea, and terminal apnea is one more permanent condition, the later condition. So like this we will have actually primary, secondary and terminal apneas when we are dealing with a neonatal care or newborn care. Primary apnea is quite common, but and also benign, whereas secondary and terminal apneas has to be very, very careful. Okay, that is dangerous. So all such conditions of primary, secondary and terminal apneas, especially secondary and terminal apneas, should be taken as acheshta shishu. Okay, the word acheshta should be applied in this context. So this can also refer to low Apgar scoring. Apgar scoring is very, very less. Apgar scoring includes appearance, activity, then pulse, respiration, and then grimace, etc. So they are all different indicators of the acheshta shishu. Child is cheshta 1 or acheshta 1. So that can be assessed by means of Apgar scoring. So if there is no spontaneous respiration due to any reason, so that can be also called as acheshta shishu. Prana pratyagamana should be done till the newborn becomes cheshta 1. So Ayurveda says that in acheshta shishu, you should start the prana pratyagamana, and till what time you have to continue? Till the child becomes cheshta 1. Yad bhavet cheshtata. Okay. So till attainment of cheshtata, you have to continue the prana pratyagamana. So this is very clearly told. Yavat bhavet cheshtata, like this. Cheshtava. So like this they have mentioned. Now these are the references if you want. अश्मनो संघटनं करणयोर्मूलो शीतोदकेन उष्णोदकेन शीते परिषेकः यावत् बहुत प्रेरणा प्राण यावत् प्राणं चेन अभिनुष्णीयात् यत् चेष्टा स्यात् यावत् स्यात् यावत् प्राणानां पुनर्गमनम्. So till again re-establishment of the prana, you have to continue the prana pratyagama. Okay, so prana has gone out, now you have to re-establish that prana inside the body. Till then you have to continue the resuscitation. So this is what is explained in Ayurveda. So next class onwards we will look into different steps of resuscitation one by one as mentioned in our science, and we will try to correlate with the present contemporary medical science, and we shall see how the concepts of Ayurveda holds good even today. So that we will discuss in the next class. Thank you very much.